Pathophysiology and Pharmacology of Hashimoto Thyroiditis by Patrick Nercessian. So I'm just going to quickly discuss the pathophysiology of Hashimoto thyroiditis. So Hashimoto thyroiditis is an autoimmune disorder in which the immune system begins to damage the thyroid gland, resulting in lymphocyte infiltration and fibrosis of the thyroid. This occurs because the immune system mistakenly recognizes the thyroid antigens as a foreign entity, resulting in the immune system attacking the organ and causing the production of antibodies. So during this, the immune system begins to produce anti-thyroid peroxidase and anti-thyroglobulin, which specifically target thyroid peroxidase and thyroglobulin proteins that are present on the thyroid. This damages the thyroid tissue, resulting in thyroid tissue fibrosis, a condition in which thyroid tissue is replaced by fibrous tissue. The damage arising from the immune system's continuous attacks results in a deficiency of thyroxine and triiodithyronine and causes hypothyroidism. In order to mitigate this deficiency, the pituitary gland sends signals to the thyroid to produce thyroid-stimulating hormone to compensate for the low levels of thyroxine and triiodithyronine. But as a result of this causes goiter, which is the enlargement of the thyroid. As a result, these consequences all develop into hypothyroidism, a condition in which the metabolic rate within the body slows down, causing a variety of different problems, such as weight gain or fatigue. Just to summarize everything here, Hashimoto thyroiditis is the result of the immune system attacking the thyroid, causing a decrease in hormone production such as thyroxine and triiodithyronine, resulting in hypothyroidism. So I'm just going to quickly discuss the pharmacology used to treat this condition. So the levothyroxine is primarily indicated for patients who have hypothyroidism and require treatment of it, including cases that have Hashimoto thyroiditis. And it's also used to help manage thyroid hormone levels. So because of this, levothyroxine is possibly the best medication used to manage this condition. Levothyroxine is a synthetic drug form of thyroxine and belongs to the thyroid hormone replacement drug class and is used to primarily treat the underactive thyroid. So I'm just going to quickly discuss the mechanism of action of this drug. So the mechanism of action of this drug works by replacing the deficiency of the thyroxine hormone, and after being administered, is absorbed by the gastrointestinal tract and begins to enter the bloodstream. Once within the bloodstream, the drug is converted by the kidneys or liver into triiodithyronine, where this hormone will bind to the thyroid receptors present in a cell. So this then initiates and increases the metabolic rate of these cells, which would result in increases in temperature or metabolism. And as such, symptoms of hypothyroidism, including weight gain or fatigue, can be treated. The indication of taking levothyroxine is indicated for patients who have hypothyroidism, including cases that have Hashimoto thyroiditis. So now that we know what levothyroxine is, levothyroxine plays a crucial role in treating and better managing Rebecca's hypothyroidism that is associated with Hashimoto thyroiditis. So it is essential that the nurse takes into consideration the dosage, appropriate monitoring, and patient education in order to provide the best possible care for Rebecca. So the dosage of levothyroxine administered to Rebecca is an essential nursing consideration as her condition could lead to a fluctuating thyroid, affecting thyroid hormone levels, which can influence bodily factors including weight or temperature. So it is therefore essential to adjust the dosage of the medication in order to provide the most effective management of Rebecca's condition. So another nursing consideration to take into account will be monitoring Rebecca. This is because it is crucial to monitor for overtreatment or undertreatment, such as an increase in weight loss or continuation in fatigue, because this could indicate that the dosage of levothyroxine is either too high or too low for Rebecca. So another nursing consideration to take into account is patient education. It is essential to educate Rebecca to ensure she continues taking her levothyroxine in order to prevent hypothyroid symptoms from returning. It is also essential to educate her on the effect levothyroxine can have with other medications. Rebecca should space out any other medications she's on to allow adequate time for levothyroxine to be absorbed properly within her body. This is because taking it alongside with other drugs may interfere with its efficacy. Therefore, levothyroxine is a medication that can be used to help treat patients who have Hashimoto thyroiditis, as it elevates thyroid levels within the body, and is therefore an essential nursing consideration to review the dosage, monitor Rebecca for overtreatment or undertreatment, and provide her education. So, just to conclude this presentation, Hashimoto thyroiditis is a condition in which the immune system attacks the thyroid. Levothyroxine is used to treat patients who have Hashimoto thyroiditis and therefore hypothyroidism. And it is essential that the nurse considers adjusting the dosage, monitoring Rebecca for over and under treatment, and providing Rebecca the appropriate education required for this drug. These are my references.